Hi guys, it's me, the medical massage lady, back for another video today. We're going to be discussing how to know if you've got a good therapist. What sort of things can you look out for to ensure that you get the best experience possible? Certainly, I've noticed going out, getting treatments, there is such a huge variety in therapists in what techniques they're using, in how they define a full body massage, their knowledge and skill. So it's very difficult sometimes, to know what you should be looking for. And the experience type of massage and how you feel when you come out of that treatment will really vary, depending on how good, obviously, your therapist is. So the question is, what should you look for? Probably one of the most obvious things would be knowledge. Knowledge of the proper technique for a start. I think there are so many places out there that really don't stay true to the origins of certain types of massage. They don't use those traditional techniques, and that can really show in the results of the massage. So my theory, if it's not broken, don't try to fix it, and stay true to the origins. I've been qualified in Swedish massage for 23 plus years, obviously more recently sports. And so I've got a very sound knowledge of the techniques, what they're used for, and really just how to focus on the client's needs and get the best out of that massage for them. Knowing the indications of these techniques is really important in getting a good result for your client. To receive a high standard treatment for your client, you also really need to be thinking about how are you educating your client? How are you teaching them not only what their issues are, but how to fix them as well? And so if your therapist has a solid background in teaching, for example, I taught student nurses, I've run antenatal clinics, I have taught massage, and I'm soon to be doing some other teaching stuff as well. So, having that education, having that therapist who, and usually this happens with the registered therapists, which is another important thing that I think clients should look for, because when you have to keep up a registration, you have to maintain a certain standard of care. And so in order to maintain that registration, you have to be looking at up-to-date research. You have to be showing through further training that you are able to continue to give good quality treatments to your clients. So yeah, it doesn't always work that way. Obviously, it's a balance, just because someone may have done loads of courses, it doesn't necessarily mean that the practical skills will be there. But it's one thing that certainly you can look out for, when you're looking for a good therapist. So other things that we can look for. Certainly, probably one of the most obvious things is value for money. Any, therapist building their business, they're going to want to try and be very competitive with other therapists out there. For me personally, I've noticed when I've gone for massages that a lot of the time it will say full body, and actually then you come out, no work has been done, around the top of the chest area or the front of the shoulders. No work has been done on the stomach area, and sometimes no work either on the buttock area either. So that's basically you're looking at legs, arms, and back, which not a full body. So, but they're still charging the client as if it was a full body. So for me personally, I like to include those things, and I usually include a scalp massage as well, just so that the client again can get the best experience possible. But one other thing to consider in terms of what is included in a full body. A lot of companies out there, whether it be a gym or a spa or some sort of, health clinic type setting, a lot of these places are very limited in their company policies. Or they, maybe sort of they have a few sort of, spas or whatever it may be. And because of these policies, it's actually quite restrictive to the therapists, and meaning that the therapists can be limited in what techniques they're using or, how they carry out a massage. Their scope of practice, even if they are very experienced and qualified to do certain things or advise on certain things, they're actually prevented from doing so, which all that does is basically limit that experience for the client. So that's definitely one to watch out for. And certainly I think that's a plus point of seeing independent self-employed therapists. Also, a lot of these extra sort of things that aren't included in full body treatments a lot of the time. So things, as I've said, like the chest area, stomach area, scalp, feet. A lot of the time, again, these sort of spas, gyms, wherever it may be, they tend to count those as extra treatments. Why? I don't know, because it's still part of your body. So if you're doing a full body treatment, that really should be included. But often it's not. And then what they do is they'll actually charge you extra for having those areas done. But a lot of the time as well, they charge you extra, but it's included in the time that you have. So you're paying extra for something that has been taken out of the time that you've already paid for. Makes no sense. So, yeah, it should really all be included. There's no reason for it not to be at all. And at the end of the day, if a client is coming in, say with plantar fasciitis, for example, they're going to want their feet to be part of that massage. That's all part of addressing that client's issue. They're not going to want to have to pay extra on top of what they're already paying. So that's definitely another thing to look out for when you are looking for a therapist. Now, the next thing that is definitely important when finding a therapist, obviously, certainly if you're going for a Swedish massage, you are going to have a relaxing experience. So certainly for a lot of people, going somewhere where it is a relaxing atmosphere, whether that be, in terms of lighting or music or, some places use candles and things like that. Just all those extra little things that sometimes make a difference to some people. And again, this doesn't mean that your therapist is going to be fantastic, but it's just something that basically adds to the client's experience, and it's a personal thing to the client. Some clients, they don't really like all the relaxing music, so it's really, client preference. Certainly customer service skills, an obvious one. I always try where possible to accommodate a client, whether it's the time of an appointment or adapting to someone's medical needs, and I will be talking about medical information shortly. It's just maintaining the communication, keeping the client informed every step of the way through the booking process, right through the treatment, and sometimes afterwards as well, by giving them information that may help them when they're back home. All of these things will help to ensure a good massage experience for the client. Offering treatments, again, we've just sort of spoken about cost a little bit in terms of what's included in the cost, but offering treatments at a competitive price. For me, if a client's session goes over time for whatever reason, maybe they just are extra tight and they just need that little bit extra, I always try to accommodate that, and there is no extra charge for that. But again, that's a lot easier for an independent therapist to do, because they set their own time frames and appointments, bookings and everything. A lot of the companies out there, they are very fixed, and it's like a conveyor belt sometimes. So if you need that little bit more, it's tough luck. Come back next time and pay another load of money for a full body massage that won't actually include everything that you need. So that's just another thing to look out for with the price and what's included in that price. Now, obviously, a big thing, not every client, when they're in for their treatment, actually wants all the, conversation. Some just want to come in and chill out, and that's fine. But some do like a good chat while they're having their massage. So interpersonal skills are certainly of some importance. Creating that rapport with a client, gaining their trust, because at the end of the day, they're coming to you, they're taking their clothes off, and you're going to be touching them wherever. And, that can be seen as a bit of an invasion of privacy to some people. So you really have to gain their trust, and be respectful of them and their own personal space. Really just generally try to put them at ease, be approachable, so that way if they have any questions, you're ensuring that they feel free to ask about their issue or their pain, and then you can answer them, and they know that they're going to get the information that they need to help themselves, as I say again, sort of following on from the treatment. And also just through the course of the massage, it's about answering any queries that they might have, ensuring that they know what to expect at the appointment. Just basically common sense things, keeping people, up to date, so they know there's no sort of, surprises on the day. I think another thing that's important with a therapist is definitely finding someone. I think when you find a therapist for massage, you have to, it's kind of like I always say, finding a counsellor. You have to find someone who's compatible with you, because everyone likes different things from a massage. So certainly you want a therapist that has a strong client focus, who is going to be completely focused on you and your individual needs in order to provide an enjoyable service for you. providing, an environment free of distractions, but that also that meets your needs and what you want to get out of a massage. So, for example, whether or not you like someone, that is going to talk all the way through the massage. Because some therapists do that even when you don't want them to. You just want that to feel like when you're going for a massage that it is that personal experience for you. One of the biggest qualities, which I'm also going to talk about in another video, is about empathy of therapists. And, this is a very important quality that therapists need to have, really. For me, I guess maybe it's kind of easy because I was a nurse and a midwife, so it kind of comes with the territory there. But again, it's about being respectful of your client. It's about understanding where they're coming from, understanding, some clients have a lot of emotional issues that are why, they may be the reason why they're coming for a massage. And so you really want to kind of put yourself in their place. And when you do that, you'll be able to offer a much better treatment because you'll be able to set the intention of the massage. It will be a lot more focused, to those emotions. So when you can kind of get an understanding of that, it just makes the whole process a lot easier. And quite often, if a client is coming in with emotional issues, it's very difficult for them. They might not always be completely upfront about what's going on. The first thing that you might know about it is when they burst into tears on the massage table. And the last thing you want to do is kind of pry into their, private life and for them to feel like you're just basically trying to get a bit of gossip. So it's just about giving the client some space, trying to understand whatever emotions they present with that may be difficult to talk about. And it's just providing that safe, comfortable environment that they know is confidential, where they feel that if they want to open up and discuss those emotions with you, that they can. And that can actually be a very sort of empowering thing for a client. Sometimes, it's a lot easier to release all these kind of pent up emotions with someone who is a bit more objective and not actually involved in your own personal situation. So, and one thing we briefly touched on there was confidentiality, which of course any therapist, any information you give a therapist should be completely confidential. The only exception to that rule is obviously if there is a medical issue that they need medical attention for, and then the therapist may liaise with some sort of other medical professional. Or if there are clear signs of abuse, then again, the therapist may have to break confidentiality for that reason. As far as confidentiality goes, following a code of conduct and registration, if you go with a registered therapist, that means that they have a code of conduct that they have to kind of abide by. And it also means that if ever there was any kind of complaint, there's that regulatory body that is actually able to help you deal with that complaint and make sure that everything really, all the boxes are ticked and it's dealt with efficiently. But certainly all medical and personal information that is shared with your therapist should be completely confidential. Okay, so other qualities that you may look for in your therapist. Now, the next one actually isn't really something that a client is necessarily going to look for. This one's more applicable to any of you who are looking to pursue a career in massage therapy. Something that's really important, and it sounds really silly, but it's manual dexterity. Obviously, you're using your hands an awful lot. You're going to be putting a lot of pressure through joints in your hands and your wrist, and even your elbow and shoulder that you're not used to. So it's actually quite important just to do hand exercises, even on a daily basis, just to keep those joints as flexible as possible, and so that you're able to perform the techniques to the best of your ability, and at the end of the day offer your client a really good treatment. But the next one in terms of the client is looking at a therapist's credentials. Now, for me, I have medical knowledge. I've got 2 medical degrees. So my experience, both as a nurse and a midwife, and also my experience of disability, really helps me an awful lot in being able to explain issues, being able to educate my clients, and also in terms of treating chronic conditions, or even other medical or pregnancy issues, because it just gives me that extra understanding, and I think my clients certainly pick up on that. As far as massage therapy courses go, I think that's probably my one real negative, my one sort of criticism of a lot of courses, is that they really don't go into the sort of contraindications of massage very much. It's just kind of a passing conversation, and I get it, because at the end of the day you can't go through every medical condition, but it's certainly something that I feel, for people going into massage therapy, really take time to kind of look up a lot of the contraindicated health issues, and a lot of the issues that that you may have to adapt techniques for, because it really is important, and it's, at the end of the day, it's for the health and safety of your client. Now, for someone like me who is qualified in a few different areas, and sort of having that medical background, it's very easy for me to take a more in-depth approach to your treatment, but that is, it is difficult to find in other therapists. But the plus side of that is that it really ensures that you're avoiding situations that basically are inappropriate, that are putting your client's health and safety at risk. And I've experienced this with other therapists. I think a lot of it, again, and sorry to kind of dwell on other sort of companies that are offering massage, but whether it be sort of spas or health clinics, wherever it is, a lot of the time, as I say, they are very restricted in what they offer, and you may have a very qualified therapist, but they may have in-house training, for example, that is carried out. It could even be carried out by someone who's not even qualified in that field, but they're telling those therapists who are qualified how to do their job, and that's when accidents happen. And so, I mean, I give you an example. I've had issues where I have witnessed other therapists doing completely inappropriate treatments on clients where it was completely contraindicated, and they really could have done that client a lot of harm, which would have involved a lengthy hospital stay. I've also witnessed inappropriate treatments being done where the client has actually contacted the place where this treatment took place, and have really just been absolutely devastated that their health just took a dramatic turn downhill, and nothing was explained during the treatment, and they really just had no idea of why they were feeling so bad, but they literally hadn't got out of bed for about a week, and there's really no excuse for that. So again, this is where, ensuring that you're with a trained therapist who's registered, and ensuring that they go through all this medical information with you before you even go in for the treatment. And I will come on to that in just a minute. But firstly, another thing that you may want to look at when finding your therapist is whether they offer any unique services. Sometimes it's all very easy, for all therapists to kind of blend in and sort of be seen as like a spa treatment. We're not all like that. We've all got very different qualifications. We've all got very different things to offer. Some will be that more of a sort of relaxing spa feel. Some will have more of a sports input. Some will be more medical. So it depends what you want, what you're looking for, what you want to get out of that massage as to who you go with. But just for example, even among sports therapists, you're going to get ones that are, basic level. You're going to get the ones that are qualified to diagnose injuries. You're going to get those who are qualified in trigger point therapy or in, myofascial release, or so many different things. So do take time just to just ask your therapist what their qualifications are and whether they specialize in anything, and that hopefully will give you a better idea of what they can offer you. Certainly for me, I find sort of my experience with physically disabled children is really a plus. Obviously the medical side, which a lot of therapists don't have, but certainly I haven't seen many therapists about that are sort of sports qualified, that deal with physically disabled children. So that's kind of one of my plus points. Anyway, so that is a lot of the things that you might want to look for and consider when looking for a therapist to ensure that you get the best experience possible. As I say, one of the things that I actually want to just briefly talk about before we finish is about medical information and, recognizing when your client has a contraindication to treatment. Now, a lot of people have asked me in the past why I do have a reasonably lengthy medical questionnaire, which I email clients before treatment. Certainly when I've gone for massages, I've found, a lot of the time I'm not asked anything about my health, which is really concerning. I may just get a very brief few questions, and there's not really an excuse. All that does, if you're not asking, enough information, it just puts your client at risk. So I'm just going to explain why this is so important. And if, whoever you choose, you kind of want to make sure that they are asking you these questions, even if it feels like, they're kind of sort of delving into your private life. We're asking it for a reason. So, and any reputable therapist should be asking these things. So I recently had a client who wanted to book with me online for a full body massage. So I sent them the medical questionnaire, asked them to let me know if any of the issues on there were applicable to them. So they replied, and they had quite a few medical issues actually. A lot of them weren't really relevant. They were certainly things that would be helped by massage therapy, but they weren't going to, really interfere with what I was doing. But there were actually two sort of main issues that actually were really relevant. And they were things that certainly one of them isn't always asked about. So this particular client had osteoporosis or brittle bone disease, and also had a history of blood clots, DVTs, and they actually had what's known as sticky blood syndrome. And basically what this meant was that had I gone ahead with the treatment, one of two things could have happened. One, they could have ended up with a fractured or broken bone and a nice lengthy hospital stay. Now, this person had already previously had a broken pelvis, a couple of years running, and broken ribs. The other thing that could have happened was that they could have thrown off a clot, obviously due to the effect of massage on the circulatory system. And this could have ended up causing a stroke or a heart attack, or, it could have gone the other way and they could have had, a bleed, which again, serious consequences. So that's why this is so important. That's why we sometimes may seem a little bit nosy, because a lot of the time people, they think they're just going for a bit of chill out time, so they don't need to mention it. And when you're living day to day with a medical condition, quite often people just don't really think of it because it's just their normal. So, it's really important to ask these questions. And even, medications. Obviously, when this particular client had stated that she had the blood clotting condition, I asked if she was on anticoagulant therapy, and it turned out she was, but it was really, it wasn't particularly well controlled. And actually, when I saw this particular client a little while later, realised just how uncontrolled it was because her legs were purple. So, if she'd gone in for a massage and the therapist hadn't thought to ask all these medical issues, and fair enough, I obviously asked them because I've got a medical background, but, you have to find these things out, just for the safety of your clients. So that is why it is so important. We don't do it to be nosy, but we do it to provide you with the best outcome possible. So anyway, that is all in terms of what to look for in your therapist. Hope it's been of some help, and even for those of you who are looking to train in massage therapy, these are things that you might want to have a think about. Think about how you are going to offer these things, how you are going to demonstrate these qualities to your upcoming clients. And yeah, I'll be doing some more videos soon. So I will see you then, but bye for now.